So hello everyone. Today we have with us Dr. Amar. Dr. Amar passed his Section 2 FRCS Urology in May 2025. We have been connected over the last few months. He has an altogether different story to share. He is based from US. He's presently working as a consultant in the United States. And yes, I think he's the only guy I know, and most of you must be hearing that a guy from the US is appearing for an FRCS. It's usually not very common, but then we'll hear from him. So, Dr. Amar, congratulations once again on your big success. So today we'll be discussing about your journey. Can you introduce yourself and take us through your journey?
Thank you. I am very grateful to be sitting here saying that I passed the FRCS, and I owe a lot to you for helping me through the preparation. So thank you.
Thank you.
Um, and it has been definitely, I agree with you, it's an unusual path that I've taken as a US consultant to do the FRCS, but I have strong ties to the UK. I grew up in the UK and I still have family there. So that was my motivation for doing the exam, with the potential for returning to the UK in the future. So,
Uh,
yeah, delighted
so
to be here, delighted to share my experience.
so we want to know just in brief how a US consultant or how a US trainee can become eligible for the FRCS exam.
Yeah, so my situation was that I did my medical school in Ireland and I had completed MRCS before going to the US for residency. Having MRCS under my belt and having had Irish medical school training was made me eligible for the FRCS exam.
Okay.
I also had references who confirmed my suitability for the examination. So in general, this is not a very common scenario. It's a bit of a unique scenario, and I think on a case by case basis, depending on where the graduate has done their training and examinations, they may be eligible.
Right, right. I think it's different from different countries. Somebody's trained in UK, it's easy for them to become eligible and
Correct.
the referees sign for them. So, Dr. Amar, how many months did you prepare and when did you all start your journey for the FRCS?
My actual preparation for part one was about 6 months. Part two was about 6 months as well. And when I say 6 months, everyone falls off and has to get back on the train. So on average, I would say 3 months of dedicated, regular, committed studying in the run up to each exam for both part one and part two. Um, and different mindsets for each exam. For part one, very focused on knowledge base, and part two focused on technique, Viva technique. Again, having you around to push me along and encourage me to get through certain parts of the Viva component was invaluable.
Yeah, we are coming to the Viva preparation because it's the most important thing and unpredictable things. Sometimes we don't know what we should prepare, and sometimes we don't know what might be asked in the exam. So, regarding the section one, you appeared in 2024.
I did, yeah. I believe it was in early 2024, around spring.
Okay, so what resources did you use for your section one, like the UK textbooks or the US textbooks?
I actually, interestingly, I had a couple of US textbooks, which is the United States Board Review book that I used for subjects that I knew were very concrete, such as infertility. That would be a subject that there's very little deviation in practice, and physiology as well. So that was my primary resource for concrete subjects. And then there are some subjects where there is variation in practice, particularly, the oncology, and relating to reconstruction, where there might be slight nuances. I picked EAU. And what I found to be a tool that not many people shared with me, but I just happened to stumble upon, was BJUI knowledge.
Yeah.
And I was surprised at how few candidates were actually using BJUI knowledge. I think it's a great resource for rapid review when you are pushed for time. in
Right.
15-20 minutes, you can cover a large amount of information for
Exactly.
BJUI knowledge.
And even the BJU knowledge has certain MCQ questions.
Yes, yes, it
Exactly.
does. Yeah, that, and it also has some video and audio lectures.
Yeah.
So I did a hybrid of studying. I used the BJUI. I did audio lectures. I would be driving and I would plug in an audio lecture and start listening while I'm driving. So I did everything I could and just immersed myself in FRCS for definitely the 3 months before the exam.
That's very important. Everybody who is listening must know that you need to get absorbed with the preparation. Just get lost in the preparation, even in your dreams. So that is why we started this Viva in dreams. Even in your dreams, you must be thinking that you are giving a Viva exam and you are asked something and you are ready for the answers. That is what the level of preparation should be. Dr. Amar, we want to hear more from you. I keep on talking in the classes, so now it's your time to just help the candidates who are appearing in the upcoming exams. So
Sure.
section 1, I think it's quite knowledge based and your day-to-day practice and concept based. Your concept should be clear. Anything else you want to add for section 1?
Section 1, I would encourage everyone. So if I were to rank my personal preferences, I used Oxford Handbook heavily, although the resource is a little bit dated.
Yeah.
I believe Oxford Handbook was around 2017, 17, 18. The resource is a bit dated, but it's useful nonetheless, simply because a lot of the major principles, the pure facts, the factual knowledge that doesn't get updated is
Yeah.
there. Everything is there. I use that as the backbone for my studying. And then for oncology, particularly prostate cancer, penile bladder cancer, testicular cancer, to pick out those details, the fine details, I used EAU.
Perfect.
And
That's important.
EAU is a bit of a very heavy resource, especially if you look at the full guideline. But I tried to take it in small parts. So on one day, I focused on the epidemiology staging. On another day, I focused on localized cancer management. Then I moved on to recurrent cancer or metastatic cancer, and then the individual drugs. So all these things, I took them in small chunks. I would fully admit my preparation was not perfect for every single subject, but I tried my best to ensure that I read everything a minimum of 2, preferably 3 times before
That's
the
very
exam.
important. Very important that you should balance everything because you will be asked question whether it's section 1 or section 2. There has to be balance among all the stations. You cannot be the master of oncology and may not know the other topics. You have to know every
Correct.
topic. Basics of everything should be clear. The concept should be clear. The exam test, every aspect of urology.
Agree. And part 1 specifically, because most of us are so far removed from physiology, pharmacology,
Yeah.
fine details, formulas, things that we don't use on a daily basis, it's perhaps more important to pay attention to these fine details in the preparation. And I genuinely found repetition was the key for me.
Yeah. For example, you might be asked on half-life of drugs. So all those
Right.
things will come into reflex only when you keep on revising. There is a book called Scientific Basis. Did you study that also?
I did. Actually, I'm glad you mentioned it. I started reading from Scientific Basis sometime, I'd say around the 6 to 7 months before the exam. And I only read it because it was recommended to be a useful text, particularly for the likes of genetics. I read it for genetics, and I found it to be immensely helpful. Eventually, I stopped reading it because I was falling too deep into it, and I decided to kind of revert back to the core text. But I would say there are many textbooks that are helpful to supplement your learning, but when you go into the likes of Campbell Walsh and Scientific Basis and you try and go cover to cover, it's very time consuming. So I would use it strategically. That would be my key point, is use it strategically to supplement the backbone, which is, for me, was Oxford Handbook.
Right. So the scientific basis is extremely important, but there is a lot of information inside it. And if somebody gets into reading it, you might spend months just understanding. And in the first reading, you might not understand anything. Like you might just keep underlining the things, keep highlighting the things. And in the second reading, you understand the concepts. Because, for example, if you talk about the pathophysiology of BPH, like in the first reading, you might just get some idea what is going on. You just try to understand it only after a few more readings. So that is what I've tried to compile all the chapters of scientific basis into one single page for section one. We try to make it easy so that you don't have to read the whole 700 pages. It's not convenient for the candidates who are going that. So this is very important in this book. So that's about the section one preparation, Dr. Amar. Thank you for your such a valuable advice. What do you think? How much time did you take break after the section one, like before your section two preparation?
On, I would say, average must have been around 3 months, where I didn't exactly take my foot off the accelerator. I kept my mind engaged. I think that's the best way. I would recommend, if you are a regular urologist like myself, such as you work, you come home to a family, it's very hard to drop down to zero and
Yeah,
resume your intensity again. I would say this is like, it's like going to the gym. You just want to do a little bit every day, or
yeah,
do some exercise every day. Keep your brain engaged. And that during those 3 months, I probably wasn't intensely taking dedicated hours to study. I wasn't taking days off of work to study, but on my lunch break, I would listen to an audio lecture.
yeah,
Um, Between clinic patients, I would have um, the Baus consensus statements. I was finding the Baus consensus statements to be easy reading, and I would pull them up, and Baus guidelines and not AUA, excuse me, EAU
yeah,
guidelines. I would pull them up between clinic patients, and I would make an active effort to look at every patient and manage him exactly, or her exactly, according to guidelines. So I
right.
would cross reference with the guidelines, and that was immensely helpful because my clinic would be general urology. I've got my prostates, my kidneys, BPH, etc. And the other thing I would make an active effort to do is I would counsel the patient on what I had just learned to practice counseling for the exam.
Yeah, I think this is the best thing about the FRCS preparation. It makes your day-to-day counseling much easier. You
Correct.
you feel
Yeah.
more confident while talking to the patients. There's altogether change in the personality when you are preparing for the exam, and when you pass the exam, definitely you are happy as well. But
Yeah.
the preparation makes you more confident, not just the result.
Absolutely. Absolutely. And I did feel my practice, I felt like I was more confident in my delivery of counseling.
Yeah,
I could provide more regular statistics, more regular numbers. So this isn't just a milestone exam on a piece of paper. I think this is a milestone exam in your personal development.
perfect. Absolutely.
Um, and I think for me, despite having US boards, I found the UK FRCS exam, there is a lot more emphasis on counseling, epidemiology,
Right,
and attention to detail when
right.
it comes to patient interaction.
Absolutely,
Um, and
absolutely.
this is definitely, I incorporated this in my day to day, which was the best way for me to exercise it.
Right. I think the counseling, what they want to hear in the exam is that you should be able to counsel the patient. For example, if you're in an oncology station, in terms of the survival, recurrence rates. So the whole oncological counseling has to be there. The complications, the incidence of the complications, just mentioning is not enough.
Correct.
So this statistics is very important. Like if you apply it in your day-to-day life, it becomes much easier for the exam. The examiners understand, okay, this guy is quite talking naturally. You don't have to make much efforts in the exam. One more thing which you said I would like to highlight, listening to this audio recordings, there are a lot of resources available, even our lectures or the YouTube lectures. So when those who are busy, who are traveling, so if you keep listening something, that also creates a lot of thoughts in your mind, and provided you are listening it thoroughly. Listening is also important. That increases your vocabulary. You can highlight the key points there and you can later on use it in your Viva. So that's also a very important strategy for that.
I
So
agree. I just wanted to share that I suppose everyone has different learning preferences. I have always found, for me personally, audio has been a strong part of my learning process. So something else that I would do is when Ankit, you and I, when we had our sessions, I would play back our sessions and listen to them in the car as well. And even though there were some situations where you would be showing a slide, um, a lot of the stuff when I was in the car was purely audio because it was not so much the content, it was the delivery of the content. And I taught myself, I trained myself to deliver the information succinctly in a non-hesitant fashion, which is ultimately what the exam is about. The exam is not purely knowledge because I think the majority of us have the knowledge. It's about how can you relay to the examiner that you have the knowledge
Yeah.
without stumbling
So
in a short space of time.
it's not just about knowledge, it's about presenting the knowledge and the performing, like performance in the exam. Just having
Correct.
knowledge and preparing and practicing is all a different aspect. Performing in the exam is altogether a different aspect. There may
Agreed. And
be people who
yeah,
have
I agree. And I think on the exam day, everyone's going to feel that pressure. And I
right.
think repetition just reduces that pressure on you.
Right. And repetition with different study partners or giving more of mock exams, trying to make yourself familiar with different cases. So I think all those things, like just repeating from the same source, because I have found candidates, they say I've read the Viva book 5 to 6 times, but still I'm not able to do well. So this happens because you are becoming familiar, you're becoming comfortable with your comfort zone. You're trying to find yourself comfortable with one book because you feel that this is all the whole exam. This exam is not about a particular book. This exam is about your practice, your day-to-day life. Whatever situation you might get in your life, you should be able to handle it. Even if you're not into that practice, you should be safely able to approach that scenario. And that comes with like you have to have an open mind. Like when you are starting the Viva, don't think that, okay, I've read this in the book, I have to say this. Start with an open approach. There can be multiple differentials for a scenario. So don't think that if you're getting a hematuria, there could be just, okay, this is a bladder cancer, so I'll just talk about bladder cancer. The exam can go anywhere. Okay, even in the oncology station, I have found the exams come to the oncology after a while. You might not even get the oncology questions in the first few questions. So have an open mind. Don't let the examiner feel that you are giving a memorized answers. That irritates the examiners a lot. That's a very important thing to have open mind in your Viva.
I wholeheartedly agree with that. I think what you said is probably a manifestation, and I'm talking from personal experience. It's a manifestation of being nervous. When you are nervous, you cling on to the piece of knowledge that you have, and you kind of you home in on it, ignoring everything else that you know in the back of your mind. And this was the practice I tried to emphasize when I was practicing with my study partner. It was to try to really show the examiner that I'm thinking broad.
Yeah,
Always start, I'm thinking broad, at least have a top 3, top 4.
yeah,
Um, and then from then, take your history according to the top 3, top 4. Make
yeah,
it very obvious that that's what I'm thinking.
yeah.
And then as the examiner starts to push you in a particular direction, I kept giving them signage. I'm thinking along the lines of bladder cancer. I'm thinking along the lines of overactive bladder. Um, but I would also like to outrule the following differentials. And once the examiner knows that you're thinking broad, they will lead you to where they want to go.
Perfect. That's very important thing. The examiners are not going to divert you. But if you are trying to take your Viva to one particular thing, the examiners might not be happy. That's very important. So, Dr. Amar, did you get all the scenarios common, familiar to you, or did you find one or two scenarios, which I always expect that
Yeah.
most candidates say one or two scenarios were not to my satisfaction. So how was your experience?
If I were to give I feel like I'm already forgetting my stations, but
Okay.
the most important thing that I noticed, nothing quite came as an entire surprise to me.
Yeah.
There was what I found was interesting. There were a couple of scenarios in the adult urology where there was, for lack of a better term, a pediatric pathology. So there was an adult station where I believe it was a 23-year-old nulliparous female who had lifelong urinary incontinence,
Okay.
and it ultimately ended up being an ectopic insertion of the ureter.
Okay.
So that's the kind of, your brain is thinking along the lines of adult pathology,
Right.
and you kind of have to start to zoom out and think, what could this have been? And there was also another situation where we had a septic stone. I remember this septic stone, and the on-call urologist, that wasn't you, stented the incorrect um,
Oh
the
God.
incorrect moiety of a duplicated system.
Okay.
And again, you're thinking septic stone, your brain is drifting towards infection
Yeah.
and management according to sepsis 6, and you see the CT scan and it's got a complete duplication. So you
Okay.
zoom out. This is what I mean when I say keep a broad mind, is don't jump in with both feet. Zoom out, slowly absorb the information being given to you, describe the CT. I feel like it is so ingrained in our heads on a daily basis to jump to the pathology,
Right.
jump to the management. But if you zoom out and do state the obvious, state that you're looking at a CT scan, a non-contrast CT scan. And I always use language which appears to show. I'm not going to say, I'm not a radiologist, so I'm not saying it shows. I say
Right.
it appears to show. And I say it appears to show a complete duplication. It appears to show a stone in the upper moiety, ureter.
Right.
And that way I'm safe in my language, I feel, when I say these kinds of things. And I've also not jumped in with both feet where I have to say, excuse me, I might have misinterpreted the situation, and then I backtrack.
That's amazing. That's really important information, that whatever information is being provided to the candidates, like you have a pencil and a paper to write down. So if you think that it's too much, sometimes the examiners will give you too much of comorbidities and too many information at the start of the scenario, and you have a tendency, or they gradually keep building the scenario and you are given a lot of information. For example, you get a urine dipstick, now you get a UFR and flow rate, and so things keep on coming up. And if you think you will not be able to assimilate everything at the end, just keep writing down things so that when you plan the management, then you have all the information with you. As you said, like you need to zoom out and have a broad vision and go slow. It's not that you have to rush quickly and progress till the last question to pass or get the maximum marks. You don't have to answer the last question. Whatever questions you're answering, make sure you are not making a mistake in that. Make sure you are being safe and you are able to identify if there is any trick in the question. So did you
I
find?
agree. I want to share that my emphasis, I know it feels good to reach the end of the scenario because you feel that you did a great job.
Yeah.
However, I tried my best to always give a an unrushed, complete answer whenever I could, because I felt that if I didn't do well in the approach to the management, I was missing low hanging fruit. You want to get those small low marks, just get them all accumulated. And by the time I reached management or complications, I felt comfortable. Like my confidence was high, and this is a big confidence game. I can't emphasize that enough. If you set out on the wrong foot, or you're
Right.
already stumbling from within 2 minutes into the scenario, your confidence takes a big knock. So just go slow, approach broadly, and as your confidence builds, it will come naturally.
Yeah, no need to rush. Exactly. No need to go very fast. Some people think that I have to say so much of literature. I've revised so many evidences. I have to quote them and I have to get them on. So it's not that. 7 and 8 is doesn't come from just going fast and reaching the end of the question. That's a different thing. If you are going to the end of the question, that's fine. But if you are progressing well, and the examiner is satisfied and you are talking well and the communication is going well, so it's fine. You may not go to the complications of the management, you might end till the management, that's fine. Remember,
I
you have
agree.
really hard. I know you would sit in the parking and you would attend the classes from the parking. So, and I know it's your hard work that you made it in the first attempt. it's a great achievement for you. I know you have invested a lot of effort in that, and what you got is the fruit of your hard work. So what's your message for the November candidates? They have 4 months to go.
Yeah, still plenty of time. I would say for anyone who is in my kind of situation where you're working and you have a family, try and keep it consistent. You don't have to do a lot of hours every day. If you can do 1 to 2 hours of valuable reading, be it audio, be it visual, or any kind of flashcards, pick a technique that works for you. Just do it 1 or 2 hours a day. Keep it consistent. Make sure you don't stagnate on a topic. That's actually something that I tended to do initially. Is I would stagnate in one large topic like prostate cancer, or a large topic like bladder cancer, and I would spend days and days on it, never truly move on. Just move on. If you don't get 100% of the subject matter, move on. If you get 75 or 80%, the next time you come around to it, try and get that second part of it. And I would emphasize to everyone that we all have the knowledge. We're all practicing doctors and urologists. We have the knowledge. It's somewhere in the back of our heads. We need to be able to bring it out in a nice, professional, succinct manner, and also at the same time think what the examiner is thinking, and that will only come with practice.
Yeah, very important message. All the candidates, they're definitely going to understand the basic strategy behind this is practice. One more challenge that Dr. Amar you had is the difference in the time zones, and you could not manage to have regular study because there was a difference in the time zone between the UK and the US. So
Yeah.
like I was kind of study partner with Dr. Amar. And
yes, you were best study partner ever.
Yeah, no, I all learned a lot from you. So it was kind of like we were study partners. I think it helps a lot when you have a one-to-one sessions and you can try to be more comfortable and you can discuss the topics like more freely when you are compared to when you are in a group. So I think those sessions were also good. So
I agree.
Dr. Amal, thank you so much for your time, and congratulations once again for everything, like for your last 1 year of hard work, whatever you did from just starting from 2024, from your section 1, staying away from the UK. Now I think maybe you're planning to move to the UK sometime in future, so all the best for that also, and hope we can meet soon.
I hope so too. I'm grateful for having the chance to have studied with you and learned from you. It's been a pleasure, and I think the overall message from me to you is thank you, and I truly hope we get to meet.
Yeah, that's very kind of you. Thank you so much. Yeah, hopefully we'll meet soon.
Yes, thank you.
Thank you.